Nurse practitioner Darrell Owens is one of a vanishing breed of care provider. Several days every month, he hits the road in King and Snohomish counties to make house calls on patients who have difficulty getting to a clinic. It's part of UW-Medicine's Palliative Care Service, specialized care to relieve the pain and stress that accompanies serious illness. Most people hear palliative and think end of life, but that describes only part of its role. Palliative care is appropriate for anyone whose health is uncertain, say, after a car accident or an organ transplant or a critical illness. A person could fully recover. But while the outcome is still uncertain, palliative care benefits patients and their loved ones. As you'd expect, much of this care happens with hospital inpatients. Owens' small outpatient team provides palliative care and primary care for people who live with terminal illness.
Our current patient census is just under 270 right now. We move with end-stage liver disease and heart disease. It just so happens that my practice is primarily cancer and dementia. So I have had patients as young as 19, and my current oldest patient is 103.
Today he's seeing patients in Seattle's Rainier Valley, accompanied by Kim Lundgreen, a UW-Medicine interpreter. Their first stop is with an elderly Vietnamese couple who have consented to share their story.
Hi. Good to see you. I look good, thank you.
She is living with cancer, and he with heart disease.
Here we go.
Owens and Lundgreen join the couple at the kitchen table.
So, tell me how you're doing, Miss Doe.
Bà đó nói cho tôi biết bà khỏe không? Bà như thế nào?
Cảm ơn bác sĩ.
Okay.
Very well.
Have you been walking around outside the building?
Owens asks each how they're feeling, with Lundgren translating questions and answers as Owens takes notes on his laptop.
Telling her phone in
You haven't taken any of her medicine yet?
Chưa có uống thuốc.
He runs through a series of familiar questions about appetite, energy level, sleep. He checks blood pressure and heart rate. He updates prescription orders and sends notes to specialists involved in the couple's care.
What we discovered was that in trying to do palliative care for the patients we cared for, they had no primary care provider, or they couldn't get to their primary care provider. We fit in as their regular primary care providers who have a basic set of palliative care skills. By blending it, they get access to a specialist 24 hours a day, and they get continuity, and they have someone actually coordinating their care.
After about 45 minutes, Owens and Lundgren are wrapping up and heading to their next appointment. Owens described the program's benefits to patients in general and to Miss Doe in particular.
We find that once you have a relationship with a provider, over time that trust is developed, that the outcomes for those patients are much improved, and that follows the literature and the primary care data that's been going on for many years. Our house calls and establishing trust through the use of a cultural caseworker was what was able to get her a definitive diagnosis and radiation therapy that has clearly prolonged her life.
UW-Medicine's outpatient palliative care program is based jointly at Harborview Medical Center and Northwest Hospital.